Hello everyone, I'm Anastasia signing in from NORAS. So in today's session, we are going to deal with a very important topic, especially for us nurses, that is documentation. What do we mean by documentation? Here, documentation is any communicable material that is used to explain, describe, or instruct regarding any attribute of an object, system, or even of a procedure, such as its parts, assemblance, installation, maintenance, and use. So this is the definition of documentation. In simple words, I can say that documentation is a material which we will be using in order to pass from one person to the other. Then through this material, the other person to whom this information must be passed will be able to understand just by reading that material. That documentation is a material which will be in a written form. So just by reading it, we will get an idea on how to perform certain procedure, how to operate a certain system, or even how to assemble, install, maintain, or use a certain object. Since we have got an idea about what documentation is, now let us move on to the definition of nursing documentation. This nursing documentation is a record which will consist of the nursing care that has been planned as well as implemented for each and every individualized patient, either by a qualified nurse himself or herself, or even by the other caregivers under the supervision of a qualified nurse. This nursing documentation is a record, which will consist of all the nursing care that you as a nurse has planned as well as implemented for each and every patient. So here you must also mention whether these procedures, these plans which you had implemented on the patient has been done by you yourself or even by the other caregivers, but under your supervision. So this is the definition of nursing documentation. Now let us move on to the next, that is the legal guidelines for documentation. As we know that high quality documentation and reporting are necessary in order to enhance efficient individualized patient care. In order to get this high quality documentation and reporting, it is very important that whatever we document must consist of the 5 important characteristics. The first one is factual, the second is accurate, the third is complete, the fourth is current, and the fifth is organized. Here as a nurse, whenever we document any information related to the patient, it is important that these 5 important characteristics must be included. In order to get a clear idea, let us discuss about each one of it in detail. So starting with the first one, that is factual. Here, as a nurse, it is very important that whatever we document must be based on facts. It must not be based on our imaginations or assumptions. So here, a factual document or a factual documentation will always consist of a subjective as well as an objective data. So what is this subjective data? This subjective data is the data which we will be collecting from the patient. So here, the complaints that the patient will be having, the concerns or the requests, whatever we get from the patient side, whatever information, whatever concern, whatever request, or whatever complaints that the patient is saying, that must be documented under the subjective data. And while we are documenting this, it is better if we do it in the patient's exact word within a quotation mark. However, when we talk about the objective data, this is the data which the nurse will be documenting based on her observation. So whatever she feels, whatever she sees, as well as whatever she hears can be documented under the objective data. For example, if the patient says that he or she is having stomach pain, then in the subjective data, you can mention that patient says that quotation mark, that is open inverted comma, I am having stomach pain. This is what I meant when I said that it is preferable if we document the patient exact words in the subjective data. However, on the objective data, as soon as the patient complains about his or her pain, as a nurse, what we should do is we must assess the pain. So here on assessment, suppose if we have used the pain rating scale for assessing the pain, or we have done the physical examination, then here in the objective data, we can specify what we have seen while we had performed the physical assessment, or even when we have assessed the pain of the patient using the pain rating scale. This is about factual. Now moving on to the second one, which is accurate. So here from the name itself, we can understand. In this, what we must do is, as a nurse, we must always document the exact measurement, be it the vital signs, or be it the blood glucose level, or any other lab investigations which was performed for the patient. If we get the reading, we must make sure that we exactly document the reading and not alter it, because here it is only through this accurate documentation that we will get a clear idea about the condition of the patient. So here, while documenting this data, we must make sure that we do it in a clear and concise manner. We must avoid the use of any unnecessary words or even any irrelevant information. We must also avoid using any abbreviations, because this can lead to misinterpretation of the data. However, when we use abbreviations, we must make sure that we only use the ones which is commonly known by each and every healthcare professional. Moving on to the third one, that is complete. So here, as a nurse, whenever we document any information regarding the patient, we must make sure that we document it completely. This document or this data must consist all the appropriate as well as the essential information. So here, as a nurse, we must not only document what are the procedures or what are the treatment that we have only given to the patient, but here we must also document through which route we have given it, at what time, as well as what was the response of the patient after that particular treatment or medication has been given. Because as we know that this data which we are documenting will be very important, as each and every healthcare professional who is responsible for providing care to that particular patient will be referring it. Therefore, it is very important that we must always document each and every information completely, so that they get a clear idea of what are the various procedures, what are the various things that has been done for that particular patient, whether it was helpful for them or not, as well as they will also get an idea of the response of the patient towards that particular procedure or treatment that has been provided to them. So here, as I've repeatedly been saying, that as a nurse, we must document each and every information, each and every procedure, each and every treatment that we are providing for the patient. So you may sometimes feel that this is a lot of work, because as a nurse we are responsible for taking care of many number of patients. So here what we can do is we can also use the flow chart or even the graphic records in order to document any daily activities which we are performing for the client, such as the vital signs, the pain assessment, as well as the daily hygienic care, since these are some of the procedures which we will be frequently doing it for the client. So in order to save time, we can document these in the flow sheets or even in the graphic records. However, here, even if we want to document something in detail, because this is affecting the condition of the patient, then we can also do it as well. So here, the presence of this graphic record as well as the flow sheets helps us to minimize the time consumption of documentation, and it also prevents the confusion that we might be having related to the values of one patient to the other. This is the reason why it is advisable that whenever we document any information about the patient, we must always do it completely. Now we'll move on to the next, that is current. So here, what do we mean by current is, as a nurse, while we are providing any care for the patient, it is very important that we must document that particular care as soon as it has been provided. Because here, if there is any delay in the documentation, then it can also lead to an unsafe patient care. Because if there is any delay, then we may forget, or sometimes we may even get confused what did we do for that patient or which medication we had administered to that particular patient, because we will be taking care of many number of patients. So in order to prevent duplication or in order to prevent confusion, it is very important that we must document each and every care that we had provided for the patient as soon as it is done, to increase the accuracy as well as to decrease the occurrence of duplication. There are many institutions, there are many healthcare agencies that are also taking the initiatives to keep a record or even computers near the patient bedside in order to prevent the omission of documentation as well as to facilitate immediate documentation as soon as the care has been provided. So here also it is very important for us to remember that in the healthcare setting, we usually follow the military timing, that is a 24-hour, because here some of the healthcare agencies have also taken an initiative to place record or even a computer near the patient bedside in order to prevent the omission of documentation as well as to facilitate immediate documentation as soon as the care has been provided for that particular patient. And also here it is important for us to know that in a healthcare setting we follow a 24-hour system. That is, in case if you have provided care for the patient at 1 p.m. instead of specifying it 1 p.m., we will be specifying it as 13. Why do we follow a 24-hour system? We do it in order to prevent the confusion between AM and PM. So moving on to the last one, which is organize. So here it is very important that we as nurses, whenever we are documenting any information, it must be done in an organized manner. It must be done in a logical way, because here, if we only do it just for the sake of documenting, then this can create a confusion. However, if we plan, if we organize, and if we document it in a logical manner, it will help not just us but also the other healthcare professionals to get the correct idea of what you are trying to portray. So here, while we are documenting, it is also very important that we must do it in a clear and concise manner. We must only document information to the point. And if you have to document about any complex situation, then what we can do is we can first think about a situation. We can note down all the points that must be included while we are documenting it, and then we can rearrange it in a logical manner and then document it. These are the 5 important characteristics of documentation. Now let us move on to the next, that is the do's and don'ts of documentation. So here, as a nurse, whenever you are documenting any information, any data related to the patient, it is very important that you must keep in mind what are the various things that you can do, as well as what are the various things that you should not do in order to prevent the occurrence of any misinterpretation or miscommunication of the message. So let us first start with the do's of documentation. Here, as a nurse, before we document any information, we must make sure that we are documenting that particular information in the correct chart. So as we know that there are presence of different charts in the hospital which is used for documentation. For example, if you want to document the vital signs, then you should make sure that you document it in the TPR chart. If you want to document the administration of medication, then you must make sure that you document it in the medication chart. So here there are presence of different charts for each and every procedure. So before you document it, you should make sure that you are going to do it in the correct chart. You must also make sure that all documentation reflects the nursing process as well as the full extent of a nurse professional capabilities. While documenting, we must also use a complete description. We must avoid using any abbreviations, especially the ones which are not well known by each and every healthcare professional. And here, when I say that we must use a complete description, this means that, for example, if we are providing any medication to the patient, here we should not just mention the medication name, but we must also mention the time, the dosage, the route, as well as the patient response towards that medication which you had administered. In case if you have provided any comfort devices or any protective measures for the patient, then this must also be documented. And here, in case if you have called the physician for informing about any information about the patient, or if the physician has called for inquiring about the patient or for ordering for the administration of any medication, then as a nurse you must also make sure that you document this. You must document at what time the physician had called, what was the order, the message or the response of the physician or even of you yourself. In case if you encounter any patient who is not willing to take a particular medication or who is not willing to allow you to perform any procedure for them, then this must also be documented and as well as it must be notified to the physician. And as we've also discussed about the fourth important characteristic of documentation, that is current. So here again, as a nurse, it is very important that you must document each and every information after the care has been provided. So here, in case if you forget to document it as soon as the care has been provided, or even though you have documented that particular information but you have forgot to add some extra information, then you can add it later as well. But at that particular time when you are adding it, you must chart that particular information with a notation that it was a late entry, as well as you must also document the exact time at which you had charted that extra information, and also you must document the date and put your signature. And as we have also discussed about the importance of documenting each and every information completely. So here again, as a nurse, whenever you are documenting any information related to the patient, you must do it in a clear, complete, concise, as well as in an understandable manner. So these are the various things that you must keep in mind whenever you are documenting any information regarding the patient. Now let us discuss about what are the various things you as a nurse must never do whenever you are documenting any information. So here the first one is, as a nurse, when you are documenting, you must not only document what the patient is saying, but you must also document what are the actions that were taken after the patient has complained about her particular condition. Because here, as I've said, as we have also discussed, the importance of a complete documentation. So here, for example, if the patient has complained that he or she is having pain, you must not only document that the patient complains of having pain, but you must also document what was the action which you had taken after the patient had this complaint. You must never alter a patient's record, as it is a criminal offense. We must not use any abbreviations that is not widely accepted, as well as when we are documenting, we should avoid the use of any unnecessary words or any irrelevant details that might later create a confusion or misinterpretation of the message. And as a nurse, whatever has been ordered by the physician must be done. We must never chart down any excuses, such as medications was not administered to this particular patient at this particular time because I was busy with some other work, or this particular care has not been provided because the patient said it was not required. So all of these excuses must never be documented. And as a nurse, it is very important that we must never document anything or any information that we have not witnessed it by ourselves. For example, if we talk about a patient, each and every patient, there will be present of 1 or 2 family members who will be taking care of that patient during the hospital stay. So here, if that family member comes to you and says that is feeling well now, the patient is getting better, and the patient is requesting for discharge. So here, as a nurse, you must never document these information. You must never document any information that is felt, heard, said, or even experienced by others until and unless it is critical. So here, even if these information must be charted or must be documented, then you must make sure that you use quotation as well as properly attribute the remarks. And as a nurse, it is very important that we must never chart care ahead of time. So here, in case if you already have the idea that, okay, today for this patient at this particular time, I need to administer this medication. So here, until and unless you administer that medication, you must never chart that that particular medication has been given to them. Because here, if you do this, then in case at that particular time you get occupied with some other work, and during the change of shift, if the other nurse comes and if he or she goes through the report and sees that it was already documented that that particular medication has been given, then he or she might not give it and saying that it has already been done. So here, in order to prevent the omission of any care, it is very important that we must never chart or document any procedure before it has been performed for the patient. So these are some of the things that you must not do whenever you are documenting any information related to the patient. So now here we have come to the end of this topic, whereby in today's session we have discussed about the documentation. We have come to know about the legal guidelines of documentation as well as the do's and don'ts of documentation. So I hope you have got a clear insight of this topic. I'll be meeting you in another session. Until then, have a good day. Thank you.